So my lovely patient here, she has acne scars from that have been here for quite a while. I think this was many years ago that you got acne, right? It was probably. And so I wanted to show the difference between acne scars and which ones are treatable with a filler. These are rolling acne scars. In fact, you can even see when I turn on a light like this, that's when it bothers people the most. Probably when they get tangential light, they see these more rolling depressions, as opposed to ice pick depression scars or boxcar scars, which really have sharp edges, and they kind of like, maybe this is one that's more similar to that kind of thing. But she doesn't really have any scars like ice pick or anything like that, and that's actually really good, because these kinds of scars are improved with, this is Bellafill that we're using today. And this is how we know that it's going to help, because if we stretch you ever so slightly, not a lot, you know, we don't want to stretch you like this, but if I stretch you and we see improvement in the scars, that means that they are, you know, distensible and they can improve with a filler under the skin. So we should be able to see an improvement pretty much right away. What Bellafill is it's a mixture of collagen, bovine collagen, meaning cow collagen, and these little microspheres called polymethyl methacrylate. And these spheres, what they do is the collagen allows us to see where we're going here and what we're injecting. And then that actually goes away after a few months, but in its place, these little spheres stay there and trigger our own collagen to form. So there's permanence. This is one of the only approved permanent fillers out there. So it's nice. So we're gonna see how we can get this improved to, you know, this sort of thing. We can distance it a little bit. That'll be really nice. And it's something potentially that we can treat you once or twice, maybe with a little touch up, and not have to do it again. So that's really nice. Okay, so I'm going to start. I'm going to clean you off a little bit. Thank you for that for a moment. I'm going to clean her off and then we'll start again. So I'm going to just kind of put a mark under the ones that we're going to treat, the ones that I think are going to have the best response over here too, because it gives her a little cheek bone, like all around here on these side here. I'm going to do that sort of thing. I'm going to come over on this side now and look at this side. Here you can see when I stretch her, see how those kind of respond really well there? That one a little less so, but this one really well. So I'm going to really try to get that one. See how if we can get probably about 9 or 10 of the bigger ones we can try to get with one syringe of filler. So I'm going to just dot them here. Maybe this one, I'll put a little line under there. Okay. And so this is Bellafill here. This is the product that we're going to inject. And it has numbing in it too, so that makes it more comfortable, more tolerable certainly, all right? But I'm gonna put a little pinch here, okay, initially, all right? Let's see, I'm gonna turn your head a little bit away from me. It is a little bit of a pinch here, baby, pinch here, pinch. This is inject a little more superficially here, and I kind of, there's scar tissue here from you know, having acne scars there, so I kind of have to thread it a little bit and inject it into the area. Are you okay? Mm-hmm. Good.
No,
not too bad?
No,
okay.
Not at all.
So I kind of try to fan it and draw it back and forth. I'm sorry, I gotta pinch you a little bit more.
No,
for that,
no, I'm totally fine.
Oh, you wanted to? Okay, I can take it off.
If you're okay with that.
Oh yeah, I'm okay with that. I thought it was actually better for that. I don't need it. Sure. Turn the light off because it's fine with me. I actually thought the camera would pick it up better, but it actually makes it harder for her to see it. You okay?
I'm fine. Good. Yeah, really good.
So I have to kind of inject and lift your head up a little bit and lean it back again. No, I mean you shift it towards me a little bit. Oh, there you go. Good. I mean like your whole body. There you go. Because you're on the edge of the chair.
Sorry.
I think you're slightly trying to get away from me.
No, never.
Turn this. There we go. Perfect. So see, we're trying to, I'll turn the light on in the end again, see if we can see anything. A little pinch here. So it's injected a little more superficially. You can kind of see there's a little more resistance because I'm injecting it a little more superficial than other fillers to try to get into that area of the scar tissue and break it up too a little bit with my needle as well. Here. Great. So at the same time, I'm kind of just keeping an eye I'm using. Let's go a little bit in the front here, a little baby pinch or two, pinch. So here. Good, doing great. Good. And you're next door. Pinch here. Pinch. And one right here, pinch. Great. Massage it a little bit. I don't want to go too superficial here. Let's do one more right here. Pinch. There's a lot of resistance when we inject into these areas. So I have to sometimes try to inject as I'm pulling back. It's called retroactive, I guess, or retrograde kind of injection. Retrograde injection. I just start mumbling when I videotape. I have to say something, fill the space. So let me turn on the light for a moment just to see. So she gets a little bit of swelling, so they actually get a little swollen in the beginning, but we should settle down. And in fact, I'm going to massage a little bit here because it kind of causes a little bit of swelling, but I think that that's actually going to look, it's actually, I'm going to put a little bit right there. Look really good. Swelling here and a little redness, but I'm going to put a little bit right there because I think we lifted up. Years ago, did you have acne? Quite a while ago.
I would say these really came from my teen years.
Oh yeah.
Yeah. Yeah.
Did you go on Accutane?
I did.
Yeah. Just one time or a couple times?
Twice. I did twice. Yeah.
Did you hate it or it was okay? You didn't really like it?
No, it works.
But I won't leave that on here. Okay, so same kind of thing here. Okay, I'm gonna start a little. Start here from here. About baby pinch again, pinch. Sorry, a little bit. A pinch. Here. I kind of try to shake a little bit before I inject because it helps to kind of distract us. I don't want to go to, I'm going to fill here again. I try to inject actually so that I can't, it's more superficial. For me, it's more, you have to feel, you feel. Interestingly, we can tell when we're in the fat area, which is right below the dermis, which is where I'm trying to get, right at the lower edge of the dermis, because I can feel like a little, it's almost like it pops through to that area. So we can kind of feel when we're in that area, and here there's more resistance, so I know I'm in the right plane here. Good, you're doing great. Pinch back here. So one of the things, sometimes our needle can dull a little more, so I'm actually gonna switch out our needle here too for you. So I'm gonna have you push against yours right now.
Sure,
So
you got it.
Okay, a little pinch right here. Pinch. There you go. Good. Pinch your pinch. A bit up here. Now I'm going to try to fill in a little bit around the areas here. So a little bit more, but I just want to evenly distribute and see where I feel like we could use a little bit more. Trying to stretch and distend this area. Other than just a little bit of bruisey here. A little wee pinch here. she's lucky she's got these nice cheekbones because they help to make this all worth it here. Let's see if I squeeze that. Actually wants to come out of my little pinch that I made. Good. Let's get a little bit more right here, pinch here. You okay? Almost done. Almost done.
No.
Okay. Now, because I'm actually have a little bit, I don't want to go too much on these, on your acne scars. I'm going to try to go where we know we want like a little cheek anyways, because it's going to stretch you naturally, you know what I mean? We don't want just puffy cheeks.
Right.
We want to stretch in a natural way. So I'm going to kind of come up against here. Have you turn a little towards me. Give me a nice frown. Okay, we're going to help to minimize that, and then raise your eyebrows up too. She also doesn't like these lines up top, so we're doing actually a little combo, a little between the eyes and the forehead line. So close your eyes. One little pinch between your eyes here, pinch. But the cheeks, we just did them. You were just telling me when the camera was off, but you actually wasn't bad at all. Huh?
No.
Amazing, because you're tough though. Cause
I don't know about that, but there was almost no pain.
I mean, it just looks a lot worse than it feels, I'd say. I mean, there's numbing in it, and it doesn't burn or anything. It's just unfortunately, the little movement of the needle under the skin. But she did just fine. She didn't even budge at all. So we'll check back on you in 6 weeks and see how you do with that. This is not bad either. I know that.
No, but you're really good at it. I've had other experiences.
Yeah. Well, I mean, it has to do with the size of the needle you use, and we kind of do things like we wiggle around, and I try to just, this is where I can make use of the fact that I like to I have diarrhea of the mouth, and I can just raise your eyebrows up for me. Okay, relax again. We put a little more on the outside here because we don't want her to have too much of a lift on the outside. We call it the Jack Nicholson when you have that, because it's too much of a lift. Some people have really strong brows and they can lift really hard there. Make sure we're nice and equal here. Turn you this way, raise up your eyebrows again. Okay, good, relax again. Good. Good, a little bit here, a little bit on the outside. One more pinch, I'm sorry, a little bit left. There, good. So those little bumps that we do with Botox, that goes away in literally 5 minutes. They're just temporary little bumps. I call them little bug bites. Let's take a look at your cheeks for a minute here and see. Good. This side here too? Sure. Good. So not bad. Just a little bit, of course, swollen and a little bruisey where we put the filler in there. But I do think you're gonna do just great. And just you have a couple ice packs we'll put on there, and we'll keep doing that. It looks really good now. I'll actually show you.
Cool.